Hello, and welcome to CubeCast, a new and original podcast show. My name is Sarush, I'm your host, and this is my passion project. Please join me as I go behind the scenes in the healthcare industry, where I invite professional doctors, therapists, and healthcare providers, experts in their field, where we go behind the scenes and ask and learn about their original stories. We talk about their ups and downs, their success stories, what it took for them to get there, but at the same time, more importantly, what their advice is to the next generation. Today is a special honor and privilege for me to have a surgeon, an acute care and trauma surgeon on the show, Dr. Marvin Hsiao. He is also a good friend of mine, so it's a special honor and privilege to have you here on the show tonight. Marvin, tonight is extra special for me because of my background with you and, going to high school with together and wanting to pursue very similar careers. But I think in undergrad, usually, I think around first or second year, our paths kind of like diverged and, you became, obviously you continued that path becoming a surgeon, but I decided to become a business owner and chiropractor over the years. Well, obviously with our ups and downs, right? Mm-hmm. But welcome to the show. Thanks for being here. I really appreciate it.
Thanks for having me. Thanks.
Thank you, man. So without much further, let's get into it. And it would be great if you can tell us what you do exactly, where you work, and how many years you've been in practice.
Sure. So I'm a trauma and acute care surgeon at Royal Columbian Hospital. I've been there for since 2017. And I do trauma, and I do sort of all the acute emergencies that come through the emergency department. Mm-hmm. So everything from appendicitis to gallstone disease to hernias to traumas like gunshots and stab wounds.
Wow.
And, all the things that a general surgeon can do, I would do. Yeah.
Yeah, so some cool stories, amazing stories, or interesting stories. Let's say interesting stories, and I guess experiences you've had. But can you tell us a little bit about your background and what, like maybe your education level and what it took for you to get to where you are right now?
Sure. So we went to high school together, and then we both went to UBC for undergrad. I did a bachelor's in biochemistry, and then that was at UBC. Then I went to Toronto for medical school. That was 4 years. And then I stayed in Toronto for another, in total, 7 years of residency. So during residency, usually it's 5 years for surgery. Yeah. But I took an extra for general surgery. Right? Yeah. So, but I took an extra 2 years to do research. So I did a PhD during my residency.
So in residency, you did a program that had a combination of becoming both like a general surgeon, but also
PhD in whatever you'd want. Toronto was pretty well set up for that. So I did 2 years of residency, and I took 3 years off to do research. And was lucky enough to find a good project and good mentors, and was able to kind of cram all that work in 3 years, and then came back to residency, so more clinical stuff for 2 more years. So in total, 7
years to get both your PhD and obviously you had your MD, but your...
this will be the FRCSC, so Fellow in the Royal College of Canada.
Of Surgeons of Canada. Surgeons of Canada. I looked it up before you came.
I don't even know what it stands for. And then after that, more training still. So wanting to come back to Vancouver, I actually came back for a fellowship at VGH for a year in trauma and acute care surgery.
Okay, so kind of like a post-specialization for people that might not know what that means exactly, right?
Yeah, so that's additional fellowship training on top of general surgery, which is a bit of a misnomer because everyone says, "Oh, you're in general surgery. What are you gonna specialize?" So that's the usual misconception. So general surgery is kind of the older term because back in the day, everyone was a general surgeon. So general surgeons did everything from orthopedics to plastics to all the subspecialties. Now neurosurgery, cardiac surgery, everything was under general surgery. Mm-hmm. But obviously, over the years, things got more complicated and nobody can do everything. So the term general surgery stayed on for what is really mostly abdominal surgery.
Okay, I see.
And some other body parts too that gets lumped in there, like breast cancer, and some surgeons still do thyroid. And so even within general surgery, which itself is a specialty, you can subspecialize further into things like trauma and acute care surgery.
And that's what you did for a couple of years.
Yeah.
Did you have to do that to be competitive? Because it's something that we'll get into a little bit more in detail later on. But was it because you wanted to be competitive to be able to get a job here? Or was it something that you wanted to do because it was a passion? Or was it both?
A bit of both for sure. So I think training in Ontario or in Toronto and then coming back here, it's kind of a different province, obviously, different, like the job landscape. People you don't know anybody, right? So I think same in medicine, you still got to know people and you got to know what you're getting yourself into. So the fellowship at VGH was very good for kind of knowing how things worked in BC. And obviously for them to get to know you and, build a bit of a reputation and a network, right? Exactly. Yeah. Okay. So during fellowship, I found out there was a hospital called Royal Columbian Hospital, which is, I guess, after VGH, it's the only other level 1 trauma center in like lower mainland. So,
is that right? I didn't even know that.
Yeah. So we do full spectrum of every trauma surgery except for burns and spinal cord injuries. But everything else is the same as VGH, but a little bit less hassle. Yeah, a little less hassle. And you've been there 8 years, right? Like just continuously 8 years at RCH. Yeah. Okay, that's awesome. And if you can maybe tell us a little bit more specifics. I know you talked about some of the trauma that you do and, some of the special cases, either gallstones or, gunshot wounds. But can you tell us a little bit more about the specific details of what a day-to-day life of a surgeon like yourself in, trauma and acute care would be, and, how many hours you work and how does that look like, in a week or in a month, Yeah. So I'll say my specifics because it's different in different hospitals and different in different specialties for sure. Of course, yeah. So for a trauma general surgery, typically you work as a surgeon of the week. So you're kind of on for the week and then you're off when you're not on. And during that week, for me, I'm on for 6 days and 3 nights. So
okay, so 9 days kind of continuous working. Well,
it's so it's still 7 days. So within that 7 days, you work six days. Like days will be like 7 a.m. to 5 p.m. And then 3 of the nights. So nights will be 5 p.m. to 7 a.m.
Okay, I see.
Yeah. But different places have different setups for trauma, but at RCH that's how it's set up. Yeah.
And then, so how does it work? So let's say, for example, the ER, someone comes in with a head trauma, right? Obviously, you get triaged. And how soon do you get to see the patient? Like, are you in the ER right away? You get to see the patient right away if something's happening? Or do you have,
so for traumas, it's a little bit different because there's actually a separate service called the trauma service, which for RCH is I'm on the acute general surgery service, but there's also the trauma service. For those traumas, the TTL or the trauma team leader would do a similar schedule. So they're on for the week and some of the nights as well. And they're like within, I think they have to be there within half an hour of the act whenever they're called. Yeah.
Okay. So say, for example, you're on the day shift, 7 a.m. to 8 or 5 p.m. you said, right? On an average, obviously it's very hard to answer this question because there's no average, but what is a typical number of cases you see where you have to obviously assess, maybe not, some of them are not surgical needs, right? Or they could be done on the spot, right?
Yeah, we do a lot of non-surgeries as well. Not all. Part of being a surgeon is kind of knowing when not to operate. Exactly. When doesn't help to operate and you shouldn't operate.
And you do the whatever procedure you're doing on the spot there, right? Or you typically get referred these patients. So where patients don't come in and see a surgeon right away, so they get seen by usually an emerge doc, and the emerge doc sees and typically works them up for say appendicitis. They would do some blood work, they would do some CT scan, and then if it looks like appendicitis, they would give us a call.
And then when we get called, we go see the patient, and I work with trainees, so we have medical students and residents, junior residents. So typically we send them to see the patients, and then we review the case afterwards. And then if it's something that needs surgery, then we talk to the patient about surgery, we book the surgery, and we do the surgery.
Yeah. So on a typical day average, would you say, if it's not a crazy day of mayhem at the hospital, how many cases of surgery do you do, and like what are the typical kind of length of these surgeries for people that don't have any? Because I think the idea that most people have of surgery is, the TV shows that we see, ER, I can't watch George Clooney, right?
I can't watch those shows because they're either
very inaccurate,
or too good or to be true, or they're too pretty.
And everyone looks really amazing now, right?
Exactly.
Obviously, wearing like a suit and tie, right? Like,
exactly. You should see my scrubs; they're not pressed.
They're not the nicest looking, huh? So, like, what would be like a typical kind of number of procedures?
So, surgeon of the week, usually we take care of inpatients as well, because sometimes we admit them without needing surgery. Sometimes after surgery, we keep them in the hospital for convalescence. So typically we have probably about 20-ish inpatients to see, to round on every day.
And the ones that you've already done
We've already seen before, yeah. And then the new consults will probably be like, typical day, maybe like 5, 10 would be very busy for sure, over like a 24-hour period.
So like a good maybe 30 cases and then how many of these, so the new patients, are these the ones that you've already done procedures on that day? So
potentially, yeah. Sometimes it's not a true emergency, so you don't rush them to the operating room within minutes. Sometimes you gotta wait in line for the surgeries to happen.
So you're kind of like waiting in line like a day or two maybe if it's not like urgent.
Yeah. So say appendix will be typically like a 4 to 6 hour wait, pretty common. For gallbladders, it could be even a few days of waiting.
That's a painful one, huh? Yeah. That could be uncomfortable, man.
And for something like a trauma, it'll be like as soon as possible, right? So within an hour or 2 hours. Yeah.
So like for those people, like for those of us that might not know exactly how this works, how would you, like, so say for example, there's so many kids, there's no surgeon, like what do you guys do? Like what happens?
If there's no surgeon?
Yeah, no room available. Like you're doing a surgery and like 5 trauma cases come in at the same time, and like you have to like get them in ASAP, right? Like what do you do? How do you
so thankfully that we don't run out of resources very common.
That's good to hear.
When you have like a mass casualty event, like I can't remember the last one we had downtown. I guess it would be like wasn't there a bus that overturned in by Hope or something, and a whole bunch of people came to different hospitals. So when you have those events, then it's just all hopefully not too much, but there's like always a plan in place, right? Like code orange is what we call them when the number of patients or the need exceeds your capacity. So you have contingency plans. So you start calling people in that are not on call, and
just kind of like bring doctors in to
but that's super rare though. That's like
okay, well that's good
like
to
once
hear,
every many years. Yeah. So typically it's the resources are set up that it can meet its needs. Like we don't run out of surgeons when there's 2 traumas, or sometimes we send to a different hospital. So if we were occupied at RCH, we can send them over to VGH for traumas.
I think there's a little bit of maybe misunderstanding or misconception in that hospitals are so overcrowded and like the ER department is always so slammed to take. You might not even get to a surgery, but you're saying that there's always contingency plans in place and that it's rare that you kind of run out of your resources at that moment.
I think so. What I tell my patients when I have to wait is you don't want to be the one who can't wait. You know what I mean? Yeah. So if you can afford to wait, you're in pretty good shape. But if you're the first one in line, you're pretty sick. Yeah. So you don't want to be the first one in line.
That's actually a good perspective, man. I never thought about that. Yeah. You don't want to be that first person because that means that the level of trauma and
we bump everyone else, right? Like everything is not as urgent as you, and you got to go first. Yeah.
Well, that's, I guess, So I guess I didn't even think about that. Yeah, you don't want to be number one.
Not when you see me.
And in terms of like the average length of most surgical procedures in and out, Like the typical stuff you see, right?
Sure. Yeah.
How long are these procedures?
So things are, most of my surgeries are thankfully reasonably short. So appendix would be like less than an hour for sure, like half an hour, an hour. Yeah.
Like of the time you're in, because obviously there's a bit of prep time,
yeah, the anesthesia time not included, but the actual surgery time when we're operating, it's usually less than an hour. Longer cases like colon cancer or like bowel resections, maybe 1 to 2 hours. So for emergency things, thankfully we don't have to operate super long, which sometimes the cancer stuff like pancreas cancer or some vascular surgeries can take like 4 hours, 5 hours, 6 hours.
And then are there cases where, for example, obviously you're in, your specialty like acute care and trauma, but you are in the middle of a procedure and all of a sudden you're like, I need more like a specific kind of expertise in this area.
Yeah, 100%.
And how does that happen? So like, do you call someone up? Like,
call your friend. Yeah. So
1 second, let me go.
Yeah.
Really?
So at RCH, there are actually now 10 general surgeons. Okay. So, and I'm kind of early / not quite mid-career yet, but still I'm 7-8 years in. We just hired 2 new surgeons who are like less than a year in. And certainly if they run into trouble because they haven't seen, even though they're fully trained surgeons, they haven't.
Of course, there's experience. Sometimes you run into like difficulties.
Yeah, so call a friend. And we all have our own subspecialties. So there are hepatobiliary surgeons, there's colorectal surgeons, there's especially hernia surgeons, and we get to pick each other's brains, and we work really well as a team. Call a friend.
So like in the middle of surgery, sometimes you have to like take the gloves off, like get on the phone.
No, the nurses will call for us.
So hold on 1 second.
Hey Siri, like can you call that? Yeah.
So the nurses call and like they put them on the line, and then you're like, you have to consultation, or sometimes like, hey, you got to come in, right? Like
exactly. Yeah, sometimes you need 2 surgeons to do a trauma. Like a lot of traumas, we operate with multiple surgeons because usually for assist we have sometimes family doctors assist us, and sometimes we have medical students, sometimes we have first year residents helping us, so sometimes we need a second surgeon to do some of these more acute traumas.
And like, is it common, for example, in your days off that you get called in and you're like, I gotta run to the hospital?
Pretty rare.
Okay, so that's a good thing. That's a good sign. It means that things are under control. Wow, so I guess, you don't think about behind the scenes, right? Well, that's the whole point of the show, like behind the scenes.
It's pretty interesting. Things I kind of take for granted. It's kind of like, why would you know anything about that? Just
exactly. And I think, we just get the general stuff, and then, social media and obviously TV doesn't help, right? It makes it all look glamorous and everything, but... But coming back to that point, I think it's very interesting because of the poise and the control that you have to have, under very like dire situations and very time-sensitive situations, right? So how do you keep it cool, man? Like how do you keep those nerves down and keep it calm?
Training, like it's part of your training, right? So you go through medical school. I think surgeons kind of self-select to want to do surgery. You want to put yourself in these situations, and
so what does that mean? Like you kind of like have to have.
If you have a medical student come into the room and see blood, and they're like, "This is not for me," they're not going to want to be a surgeon, right? So you kind of self-select to kind of want to do things with your hands, things that you can hopefully fix by physically doing something. And then during residency, you kind of develop those skills, right? How do you when your heart's kind of racing, you're kind of excited, how do you still keep it calm? It's just training.
Yeah, I guess training and practice. But I'm very curious about kind of like that transition when you're a resident. Obviously, you always have an attending practitioner, right? Like controlling things, or maybe he or she is like controlling the situation, and then you can always kind of like rely on that person. But then that transition where like, okay, here's your certificate, Marvin, and you're now.
It's a very slow and gradual transition, though. It's like 5 years of residency, right? Another year of fellowship. And people, people do fail. Like if you don't meet the requirements, you get held back, and you do extra years, or you don't graduate. so those things do happen. So, but pretty much people.
It's like a slow kind of like.
Yeah, it's a graduated responsibility for sure. Like if you're a medical student, you get to learn how to suture things, and then get to do more and more after that. Yeah.
Do you remember your first day when you were like, okay, I'm the person in charge of this, I make the final decision?
Yeah.
How was what was your
I was locuming at in Abbotsford actually. Yeah, I did I think just under a year in Abbotsford Hospital, and so even things like appendicitis, like things you can sleepwalk through, or even the first or second year resident can do. I remember that, hey, this is me now, right? So you got to make sure that you don't want to be no one is a new surgeon who kind of screws up, or new surgeon who has complications. Yeah, exactly. So you definitely do feel extra responsibility, but you kind of realize after pretty short time that you're a well-trained surgeon like everyone else. Like, the Canadian system is like, if you finish, you're a safe surgeon.
It's a tough system, right? Yeah. To come out of, right? It's very rigorous.
It's hard to get in. I don't think it's hard to get out.
It's hard to get into than to get out.
Yeah, for sure, right? Yeah. Like, I don't know how, like, you see people's CVs nowadays are pretty incredible. Like,
and to get into medical school, I think you have to do like 10 years of volunteer work. I don't know how people do it. Like, they start in high school. Yeah, it's crazy.
So definitely harder and harder now.
Yeah.
So
I think it's only like the first time to try. Well, it used to be. I think UBC used to have, 2,000 applicants, and only a couple of hundred people they would take for
like
first
10%
year. So 10%.
Right. Yeah.
I think it's gone down to maybe like even 7-8% now. So it's very competitive. Yeah. So it means like 93% of people first or second time try. They don't get into medical school, right?
And so these are good candidates too, right? They meet all the qualifications, but just numbers game. You don't get them.
And there's only a handful of medical school or medical programs in Canada, right? Yeah. Now, I know it's kind of like a cliche to always ask, but I think everyone wants to know, man, what are some interesting stories? Like maybe tell us a couple of interesting stories that have stood out in your mind. Hopefully good ones, obviously, but I want to ask you about maybe if you've had some, crazy stories that.
There's a lot of crazy stories that we share among friends who are surgeons and they kind of understand that are kind of inappropriate in front of the general
Of course, whatever you can, obviously. But we want to push the boundaries here, with our guests that are very curious to see like what like how stressful is the show. Like my point is basically, I think it's not just the gratification and like the just finishing something and like getting all the glory, right? But with any profession, especially medicine, sometimes things you have situations where like, oh man, like didn't go as well as I wanted to plan. And in your specific case, like when that happens, the outcome is not great, especially. But
people die if you screw up or you don't do as well as. Those are tough. Those are kind of very personal. So you do have situations where we reflect and try to figure out, can you do anything different? And thankfully for me, not too much more. But even
so, that's good. It means that you haven't had too many.
Yeah, thankfully. But I think despite your best efforts, a lot of times some things are not can't be fixed, right? Like there's still limits to what we can do. Like gunshots that are not fixable. There'd be metastatic cancer that shows up that's not fixable.
Yeah, you just have to go deliver the news, right?
Yeah. So a lot of that is the work is not done in the operating room. It's kind of afterwards or during when you talk to the patient through it.
So can you tell us a couple of good success stories at least that kind of stick out?
Most of them are good. Most of them are very straightforward. Like I would say success rate for general surgery, acute care surgery, like bread and butter stuff you expect to be perfect, right? Like appendix and gallbladders and hernias and the ones that are not great would be, you typically don't want to take the patient to die on the table. So someone when you're operating because of blood loss or because of their injuries, they die on the table. That's typically not great.
No, but and you said that hasn't happened to you.
Yeah,
right?
For sure. Yeah. It
okay, well, to all of us. Hopefully it never happens because no one ever wants to go through that. But but that's fantastic. But like, how do you? So as a surgeon, obviously you said you have to be good with, seeing blood and being able to manage your stress on the spot because it's time sensitive and you're doing the procedure right on the spot, right?
Yep.
How do you manage to control your nerves? Like, what is a good strategy that you use, and what has helped you over the years to keep yourself calm and relaxed and poised and
I think you kind of draw on your experience, right? Like things are not that stressful, and you've seen it many times, right? Like even though it is kind of a chaotic, time sensitive situation, but if you know what the next step is, you kind of go one step at a time. It's really no magic to it. You can't just say, oh, I got to do this to calm my nerves. It's kind of experience and training and
I guess you got to do what you got to do at that moment and get it done, right? And it's in your hands.
I think people get stressed out when it's out of your control a little bit, right? Like I think surgeons are most of us are control freaks, that we want to have control of what's going on. You want to, but when you don't have control, that's when you start to, I guess, panic and get stressed out. But in the operating room, we're pretty calm usually. It's just kind of where we work. It's like in your office, right? Like you're not very stressed every day. Yeah.
Not anymore. Yeah. Well, I do remember, like the first 6 months of practice, it was tough, like being on your own. You're like, oh, you have your license now. I don't have an attending clinician, kind of like running into him or her and saying, hey, like, what do I do in this situation? Because, and I remember like I had so many days where I was like sweating, right? But I'm not trying to show the patient, obviously. But like there's like a pool of like just water running down the back of my shirt. And back in the days, I used to actually dress up quite well. And like sometimes we were like tie to work, right? And I stopped doing that because the line was showing in my back. Like I'm just wearing polos or t-shirts, right? Over the years, I think. But yeah, I guess with practice and just repetition and doing things, it kind of makes you a little bit easier. And then the more obviously you have cases, right? Then
I think so. And I remember I think one of the older surgeons told me when I was in my trainings, like they call the operating room a theater, right? The old British thing is like an operating theater, so it is like you're putting on a performance. So you gotta act your role. Like this is your chance to perform.
That's interesting because that word performance, one of my mentors told me too, is like, think of your room and your job every day as if you're in a professional team, performing every day. If you're going in front of 20,000 people basketball game, you're there to perform. Like you got to shoot that three and you got to make it in, right?
Yeah.
And so think of your work every day going to perform, right? And I think at first maybe it might have put pressure on me, but then when I started thinking about it, like, what, actually I kind of reversed it a little bit. I'm like, what, I'm going to go to work, be ready mentally, physically, like emotionally, right? And I think with practice,
I think it's
keep shooting 3-pointers, right? Ultimately, you, like eyes closed, you just shoot it in, right?
Part of being a professional is that, right?
Exactly. So in terms of kind of your work and we talked about a little bit of the stresses that you go through. What are some of like the challenges that you face with your profession and your specific job?
I think when I started at RCH like 8 years ago, it's it feels like things every year is getting busier. Like there's more patients to see. There's a little bit more like not as many hours in a day anymore. Like before, it just seems like maybe we have average 10, 15 patients a day. Now we're 20, 25 patients a day. So
with the same resources?
With the same resources, yeah. So that feels like I'm walking a bit faster. I'm not eating lunch as much, or still try to spend time with the patients, right? But still, like everything else gets cut down, like less teaching for the students or residents. So I think that part is tough. I think that's part of just time, right? Like things do tend to, population grows, there's more sick people, they show up, and eventually you'll have to change. Eventually you'll be, hey, this is too busy for one person. Like VGH now have 2 teams. They used to have 3 teams because they were so busy. Yeah.
So I guess from a doctor's perspective, it can be frustrating to see that sometimes the system is, like it's just like getting a little bit busier and more crowded, and sometimes it's not even in your control either, because you're you're basically working like in the system, like you have a job, right?
Yeah, we have no control who comes in through the emergency room, right? Like it's So a lot of that planning behind the scenes, it's outside of my control for sure.
Yeah. And I guess even the way the system is set up, like there's only so much input you have, right? With the policymakers and how much resources you guys get, right? I guess you can make recommendations, but at the end of it, it comes down to budgets and all that kind of stuff.
Absolutely,
right?
Yeah, it's a whole system for sure. We're just a small piece, part of it. Do what we can.
Yeah, so you're as frustrated as the patients, I would say, because
I tell them, hey, I'm also waiting. I'd rather operate on you now than next day or day after.
Yeah, because I think the misunderstanding is that. Patients, there's a lot of complaints that there's like big wait lists and hospitals are overcrowded and there's not enough resources, right? But it seems like it's not just the patients, it's also the doctors and even sometimes even the policymakers their hands are tied, right?
For sure, yeah.
There's a little pause there, man. Well, thanks for keeping it, not bringing the politics into it. Well, I guess the doctors, majority of the doctors are not policymakers. Their hands are tied to, you're tied to the system.
So we have different priorities, right? Like it is, healthcare competes with education, competes with everything else in the government. So, like during COVID, it's like, health is very important, but hey, same with like banks and restaurants and commerce, and so it's kind of depends on which perspective you take to see. It can get frustrating.
Fair enough, man. Maybe that's another topic of conversation we should have about
we won't open up that can.
Well, maybe we should open up the can a little bit to talk about like the behind the scenes and the politics as much as we can get into. But that's another talk. Maybe Dr. Marvin Hsiao 2.0. When
I try my best to stay out of that. Other people are more interested in sort of administration and for me it's. Work-life balance is important.
That's the most important, man. That's like one of the topics you want to talk to because you're a good champion of this work-life balance, man. I've known you for 27 years now, and it's getting better and better. But let's take it back to a notch, or back in time, and talk about your mindset and what was going through your mind as a teenager, young child, and then early adulthood, and wanting to become a surgeon or pursuing surgery. And did you always know at one point where you made decision, you were sure, and so kind of maybe walk us through that a little bit so that we kind of pick your brain and see like how did you 30 years back?
Yeah, sure. I think we're all kind of a product of our environment a little bit, right? Like. I'm sure your parents are the same as mine, who've somehow brainwashed us into thinking medicine is a good job.
Is like,
exactly.
Like
sure. But I think my parents were pretty subtle about it, and then I was kind of just taking the next step, and I'm in medical school.
So just to give us background, you were born in Taiwan, right?
Yeah.
How old were you when you moved to Canada?
I was 10.
Oh, I was 11.
Yeah.
I told you our backgrounds are very similar.
Exactly. We're like brothers from different continents.
Yeah, man, it's so very similar. So very similar. My parents never really directly said anything, but I think, in the Persian Iranian culture, it's always like, three professions are like, kind of like stand above and beyond everything versus medicine. All the parents want the kids to become doctor, and then it's engineers and lawyers. We have very good doctors, engineers, lawyers from Iran, right?
Yeah.
And I think very similar, right?
From Asian cultures for sure. It's very, very cliched. Yeah.
And so kind of a bit of an indirect pressure, never say, Marvin, we want you to become a doctor. But it was always like, it would be good to be a doctor. Well, that's a good profession.
Yeah, no, but my dad was a doctor, or is a doctor growing up, right? So I think that you kind of see what your parents are doing or your relatives are doing and say, hey, that's kind of part of how you grow up. I think if you grew up with a bunch of athletes or musicians, or I'm sure you'll be very different. You probably won't want to be a doctor if your parents are musicians and then you see what they are like. So so I think that's part of it. And
so from childhood, I want to become a doctor, but specifically a surgeon.
Surgery was during medical school for sure. Like I think most people go into medical school not knowing what kind of doctor they want to be.
Yeah.
So usually the first couple of years is classroom learning. So you learn everything that's the same. And then third and fourth year is clerkship. So you kind of you rotate through different specialties and just kind of figure out what kind of doctor you want to be. And for most people, it's kind of a stressful situation, right? Like
I have a lot
you got to figure out what kind of doctor you're going to be, and hopefully you don't make the wrong choice and regret it.
Because it's one of those decisions that it's not like you could just make it and next day change it, right? Like it's you got to kind of make
you have
it right.
You have like 2.5 years to make it, because by kind of middle of third year, you kind of have to set your electives and then figure out what you want to be.
And most residency programs, you have to get in, and then you have to select which university, get picked, or are matched, right? And then they're usually minimum 3 to 5 years, right? So that's
so family docs is 2 years,
2 years,
and then everything else is 5 years.
5 years,
But you can't switch. People sometimes figure out at some point during a residency that, hey, I'm not cut out to do this, or I want to do something else, and then they switch. So it's possible.
So tell us a little bit more insight. I know you're a super smart guy. You're very relaxed, man. You're like the best.
Not the smartest guy. No, not the smartest guy for sure.
You're pretty smart, that I know. But tell us a little bit about the effort. I think it's very important for the new generation, and anyone that will come or has that cliche from childhood, I want to become a doctor, surgeon, right? And I think sometimes people, see the before and the after, and those years in between, the efforts and the dedication and the sacrifices you have to put. Because you said, for example, you went to Toronto for 11 years, your family's in North Van, so separation with that. But minus that, the effort that it takes to go to medical school, and then the effort for residency, and then the fellowship that you had to do. So maybe walk us through that a little bit and give us a little bit of the juice, of like...
How much work does it take?
How much work does it take? The moments you come home, you're like, oh my God, like, is this ever going to, change?
So now during the weeks that I'm on for work, I'm on for 101 hours of that week.
Oh, wow.
Yeah. And for me, that's like, it's pretty good. pretty standard.
Lot,
it's a lot of time.
That's almost like 3 weeks of work.
Yeah. So I'm definitely very tired by the end of it. But I think during your training, you train to be able to do that, right? And you kind of self-select too. Like not everyone wants to be working overnight or shift work or that kind of stuff. But there are perks for it. And there's people, for me, it would be harder to do even like a 10 to 4 job Monday to Friday. I would struggle. I would struggle with that.
Like when is 4 o'clock coming up?
Yeah, exactly. And versus I like a little bit of unpredictability and a little bit of chaos in my schedule. I think that keeps me a little bit off balance and a little bit
keeps your brain going.
Yeah, I think so. I think so. And then when I'm off, when I'm not working, I'm fully off. I'm doing things like this. Like
man. Well, thanks. It's like 9 p.m. and you're here, like past your bedtime, you're saying. But I know when you first started, and correct me if I'm wrong, because you told me that before, the first few years you were working really odd hours at the Royal Columbian?
No, it's still the same. I've always been, so even at Abbotsford, I was doing acute care surgery as well.
Okay, so I thought you were working like overnight or something.
Yeah, so I still do. Yeah, still the same schedule, still a week at a time, and still some nights of that week. Yeah.
Okay, so kind of like past your bedtime, you got to be up.
It's apparently not healthy for you to be in this kind of schedule, but I think with enough time off and with the right mindset, it's probably okay.
You can come back.
I'll figure it out. Yeah.
So maybe tell our viewers and the teenagers and all the young adult students that are in their undergrad, how tough is medical school? You went U of T, right?
Mm-hmm.
Yeah. It's probably one of the top medical programs.
Definitely,
one of the top
quite
ones.
good. I think all the medical schools are
Canada's
totally
pretty standard.
fine.
They're pretty good. Yeah,
I think so. I think because after medical school you match to residency across the country, right? So we have residents from who went to medical school everywhere around the country, and they're all just as good.
Yeah, that's the good thing about the Canadians. It's very standardized. Pretty standardized
for sure. I would say if you made it into medical school, you'll do fine. because you've I think their
pass the
selection.
test.
Yeah, I think their selection process is looking for people who are able to do the work and they're smart enough and they've shown some kind of aptitude to be able to do the work.
But it is a lot of work, man. I think you're kind of like very making it sound a little bit.
Maybe I don't know. My standards are what I know, right? But they're it's obviously not easy. Like you're not you have to put in the hours, you have to put in the work.
A lot of hours, a lot of work. Obviously with like the classes. But I think third year mostly, right? Third and fourth year, you do a lot of rounds, right?
Yeah. So clerkship is doing different rotations. So you'll be like for this month, you'll be a general surgeon. Next month, you'll be a obstetrician, and next month you'll be family doc. So you kind of see what different specialties are like. But most of medicine, you get to choose your hours. At least you get to choose your job, right? And then the job comes with whatever hours that you want to do. So for some general surgeons, it's 3 days a week. You can job share.
This is during residency.
No, this is afterwards.
Oh, afterwards. Yeah.
Residency is meant to be hard.
So how hard is that? That's, I think, so 4 years of medical school, obviously, if you made it in, you said you can finish it. Obviously,
I think so.
It's like
I think so.
standardized. It's pretty like it's got a procedure, right? And it's a lot of work, a lot of hours, but it'll get done. But then once you you got matched to like Toronto
for general surgery. Yeah.
General surgery, and so 5 years of that. Walk us through.
So you do rotate through different specialties in the beginning too, but usually for a general surgery rotation, you're on call 7 nights of the month on average. So what's that? 1 in 4.
So when you say on call, what does that mean? So
that means you're staying up all night.
How long? How many hours? Like what does it look like?
So the rules, which has been in place since I was a resident, is usually about 24 to 30 hours.
You have to be on call. Sometimes you get to work all of those, right?
For residents, mostly you're not sleeping. So now when I'm on for like 100 hours a week, at night I'm usually at home answering phone calls, and most of the time hopefully sleeping. And my residents, my medical students
up at the hospital.
They're up seeing patients, and then we review over the phone sometimes. But obviously you have to come in for surgeries.
Of course,
But during residency, you're the in-house person, right? So you're up.
You're doing like the grind work, like it's just a lot.
You kind of have to, right? Yeah. If you don't do it, then you won't learn. You don't.
Yeah, you got to put the hours in, right? And I think there's a system of kind of seniority as well in medicine that's very well established for probably a couple of 100 years at least, right? Where the junior residents, they got to go through the process, right? There's no questions about it, right? And it hasn't gotten easier.
There's more work hour restrictions for sure. And I think before they're always there, but not followed.
Maybe like now, labor laws have changed a little bit.
But labor laws have always been there, but they're more stringently followed now.
Yeah.
So now
it's like 40 hours. This is cool. Like 2 days of no sleep.
Yeah. So like one generation above me would be like 1 in 2 call, 1 in 3 call. Every second, third night they're in the hospital. That's why they're called residents, right? They live in the hospital. They're residents.
Yeah. The terminology comes from that, right?
Yeah.
That's crazy, man. So
so nowadays we look at like people who are coming up now, like you have it pretty easy. You go home after 24 hours.
Yeah, well, I guess you've paid your dues right now, but it's not like that. Yeah.
But no, I think for medicine and for surgery, it's like any other profession. You kind of have to learn on the job, and it's a number of hours and the effort and the time makes you have to invest it. Yeah.
Do you miss residency?
It's a good time for sure. Yeah.
Really?
No. I think so. I think you
learning.
And like people like tomorrow night. I have a resident friend who's coming from Toronto to give a talk at 5 Sales, and
nice.
Yeah. So it's like a special technique that he's learned, and he's kind of showing how to do it. So
very good.
And these are friends that you develop very close bonds with during residency, because you're up all night together. You get to see, if you don't sleep for 24 or 30 hours, things get you get a little bit closer for sure.
Yeah. So going back to your decision, wanting to become a surgeon from childhood, and kind of what was laid, maybe indirectly for you, and then you just continued on a path, right? And you have had a very kind of smooth, path from my perspective, at least. But two questions. One, you did a PhD, right? And I want to maybe learn a little bit about your decision to do that. Like, what was your thought process behind your mind? Because, like, was it even necessary? Like, why did you do a PhD? Because it took an extra couple of years, right? And now, do you even do research now or not, right? I guess, if you do. But I guess the second part of the question is, were there a lot of, like, any moments where you're like, oh, like, is this for me? Like, do I actually want to become a surgeon? Like, I kind of want to pick your brain at that a little bit.
I think for me, you're right. It's been pretty smooth sailings, which
it has been. Yeah.
I think in retrospect is great. But I think for the bigger picture, I think you always see these really good successful people. Like, I learned the most from my failures, and I failed 5 businesses, bankrupt and all that, and then now I'm this perfect person. For me, it's been pretty smooth.
So you're always, like, happy with your choices.
I think so.
And that's like satisfaction, and like, oh, this is for me, and I'm enjoying it.
I think so. And for I think you gotta be able to kind of reevaluate and kind of assess what your goals are every few years, right? Like, it's like for us, it's kind of set in place. Like, 4 years university, you got to figure out what your next step is. 4 year medical school, you got to figure out what you want to do next. In residency, you got a job and all that. But even outside of that, you gotta be able to self-reflect and see, is surgery still the thing? Then for me, it's always been, why not?
So you've been always like maybe self-reflecting more continuously, kind of like along the path and along the spectrum of your career.
And then for the PhD, you're asking, so why the PhD? So in Toronto, it's very skewed, right? So all of our teachers and all of our role models are academic surgeons, meaning they wear many hats. They hold 5 jobs at a time. They're a surgeon, they're a scientist, researcher, they're an administrator, they're a teacher. So everyone are like, they're
doing a lot of things at the same time.
They're like very good surgeons, and for many different things. So seeing those people, it's like, hey, that's a pretty good job. I get to do a week of surgery. I get to do some research. I get to do some traveling, and so being like that. So hey, so PhD would open up those doors for sure.
So we do a bit of research and also maybe some like administrative type stuff. Okay.
And then and then I did a PhD and kind of see. So that did open up like fellowships are. They have a good research background. The fellowships are applications. It's still an application. It's
so I guess it gets you more competitive, right?
Yeah, for sure. You get to kind of pick where you want to go. So for me, coming back to Vancouver, it was pretty smooth as well. Or if I wanted to go elsewhere, that would have been helpful for sure. Okay. So it opens up doors.
Oh, okay. That makes sense. I guess where the training is happening is what the kind of culture is there.
I think so.
What's kind of like indirectly expected, kind of, right? I guess maybe.
I think most of us are not so strong that we change our environment. Like, wherever you go, you kind of change where your environment is, but versus the other way around, right? We're kind of a product of our environment more so for most people, not for everyone, but for me, for sure. Like, for me, it's like, hey, in Toronto, this is kind of the mindset, and that's how it turned out. Yeah.
What was your PhD in?
In epidemiology.
Okay. No, nice. Diseases. Do you do any research right now as well, or
not very much? I would say zero.
Zero.
For the first few years, I did a little bit, just but I think for like, one of the things that I probably didn't appreciate is like how like when you have so many jobs, it is definitely very stressful, like the number of hours. And so now on my off weeks, I'm very much off. But if I was at, say, Toronto doing a research job, my friend that's coming over, he's a trauma surgeon at St. Mike's in Toronto. So he's
St. Michael's Hospital,
St. Michael's Hospital, downtown Toronto. So lots of research, lots of clinical work.
I guess like what the culture is. Like every place has a culture.
I think so. I think so. Yeah, and you got to love what you do. And for me, if I had to pick writing another paper and doing research versus going hiking and chilling with my dog, and it's for now it's a no-brainer.
It's a no-brainer. We talked about the success stories and how your job is satisfying for you. What is the level of gratification that you get from your job? Like how, obviously when someone's body is in your hands, right? And then you're doing a procedure and it's done. What is that level of gratification like? Like how does that make you feel?
Pretty good. Yeah. When you do a good job and then patients do well and then they tell you and they thank you because you follow up on all the patients you operate on, right? And I say 99% of people are like, great, thanks for
grateful and very happy, right?
It's like things worked out really well, and thank you for everything. And I think having that chance to work with people and kind of making a very positive impact on them, and this is kind of your daily routine. That's kind of neat.
So very gratifying. Yeah. So always people thanking you for job well done, huh? Yeah. So that's interesting. I think because no one wants to hear or see anything that doesn't go right? But I guess if it's 99%, it's been
But even the ones that don't go right, say patient had a bad outcome because of X, Y, and Z, you're still there taking the patient through that process, right? So even though, say their family member passed away or the family member had a prolonged stay because of a complication, you're still there taking them through the process, and I think people are still appreciative of that. Yeah.
Of the fact that you care about them and you're doing your best, right? That you can, right? In your ability. Now, I want to get into a little bit of your kind of like personal life. You said you work, week and a half of the 4 weeks, right? In a month, about 101 hours. You said, so 110.
101, I think. Last time I counted.
So that's basically that's almost like 3 weeks of work, maybe 2.5 weeks of a 40-hour job, right? But that gives you the time off and the privilege of having maybe 2.5-3 weeks off work in a given month. I guess again, that's your choice. Maybe explain that to our audience and people that's kind of like what you've decided to do, because obviously you could do more if you want to, right? And so
there's always a limit for sure. For me, I find the sweet spot is about 20 weeks a year of this. And I would say for other surgeons who are doing trauma and acute care surgery, they probably do similar as well.
Why is that though? Is that because of the pressure and the stress of the job?
I think so. I think you definitely can't do, say, every week you can't do it like this, right? Like it's
of course, that's a lot of hours in a week.
So and then what's the balance? So you're gonna balance between working too much and burning out, and working too little when your skills are maybe not as up to par because you're out of practice. So, and
it's a set of skills that is highly needed in a society as well, right? So we've done all that training. So and then a little bit about like how much money you need to live as well. Yeah,
like
that's coming up as question right over here.
So how much money is enough? It's a very personal question. So I'm very
we'll get into it in a moment.
I'm definitely very average. I'm not very high or very low. So I think we always compare with our peers, right? Like you don't want to be. Well, maybe you do. Maybe you want to be number one. But for me, I like to be right in the middle amongst my peers. I'm okay.
Well, speaking of that. I think there's a bit of a stereotype with most people, including myself. Like, surgeons, they make most specialists, most medical specialists make pretty reasonable, good income, right? Obviously, with the amount of training that comes, and I think especially surgeons, sometimes they put at the top of the pedestal in terms of top of the medical positions in terms of the amount of money they can make because they're doing procedures, right? And I think the stereotype is that this typical surgeons working so many hours a week makes hundreds of thousands of dollars, and they all have like nice houses and, drive super nice like cars to the emergency room or like the hospital. They park it. It's like, the surgeon's car. And then they all have boats for some reason. I don't know why everyone thinks like all surgeons have boats. Do you own a boat?
No boat.
You don't own a boat?
No fancy car.
You're not going to invite me on your boat, Marvin?
We can rent a boat. We can go for a day trip.
I can rent a boat. But I think there's that stereotype, right? So maybe shed light on that stereotype a little bit. And
so surgeons, I think, make on average, any specialist, right? Any 5-year specialist, on average, probably make a bit more than family doctors. But that changes with time, right? Because now the BC family docs got a new contract, and they're pretty competitive now. So it kind of swings back and forth a little bit.
And they also, a lot of them can do procedures, right?
So most people are fee for service, meaning the more you work, the more money you make, and sky's the limit, right? Like if you're nuts, you want to work until you burn out very quickly, then no one's going to stop you from doing that. But you are a professional, so most people have some sense. Very few people go crazy and try to. Well,
there are some people that.
Definitely there are. Not all doctors are good people for sure.
Well, I think it's just human nature. If you have the opportunity, some people take advantage of it, maybe too much. But for the most part, I think that stereotype exists with a lot of surgeons.
So it is a self-regulated profession, right? Like you are judged by your peers, and your self-regulation among your peers, right? So
like your billing. So maybe
So if you're a top biller in your specialty, you can get audited. So
like, why is this person off so much from like the average, right?
Why and so you go through a process. Are you doing it incorrectly? Are you misinterpreting the fee schedule, or are you really just working your brains out because you're
because that can happen, like.
And doesn't mean you're doing it wrong.
Or,
it doesn't mean you're doing it wrong, but just you're an outlier, and why so? But I think most people are very, very bell curve, right? Like it's average is average.
So someone like yourself that works the hours that you do, obviously like 101 hours like in a month, right? So you're kind of like more of the kind of like middle ground of where.
So I think I did the math, because every year when we fill up our forms, you have to say on average how many hours you work, right? So I think for me, number of weeks and number of hours adds up to about 44 hours a week for 48 weeks.
Oh, okay. So that's pretty.
So it's very average, very average, right? But I just stack it differently.
I work more than you.
Yeah, but I just stack a little bit differently. Yeah. So and then after hours, you appropriately so get paid a bit more, right? So to be doing things after hours versus regular hours.
Okay, I see.
So that's part of the compensation as well.
Working like kind of like into the night versus an 8 a.m. to 5 p.m.
Exactly, for emergencies, right?
Yeah, I guess you're more tired. You have to receive. So tell us, man, what kind of car do you drive? Just want to know what is a acute care trauma surgeon RC?
Among my 5, I have like some very, very close friends from medical school, and I drive the shittiest car.
What is it, man?
So one, not mine. So among the friends, one drives an R8.
Oh, Audi R8. Oh, that's a nice one.
Another drives just got a Porsche
911,
like a Cayman or one of those SUVs.
Cayenne.
Something like that. Now there's always been a BMW 3 Series.
But those are filled in Vancouver. Everyone has those,
but recently just switched up to like the AMG or the whatever.
Mercedes AMG.
And I drive a Subaru.
What kind of a Subaru?
Top of the line Subaru.
All-wheel drive at least.
All-wheel drive, yeah.
Oh, that's
not a car guy. Car just gets me there. The first self-driving car, I don't care how much it is, I'll buy it.
Well, Teslas are technically supposed to be like that.
And they can't drive me door to door.
Fair enough.
Yeah, but if I don't have to drive, that'll be perfect.
Yeah, I guess, No, that is some topic that I want to get into a little bit with that work-life balance that you have and kind of, your approach to life of how things are important. But one quick side note is, I think a lot of questions that come up sometimes when we talk to doctors and especially specialists that have, stressful jobs and work some of these hours that you do, how does that impact your personal life, your relationship and that kind of stuff? And how stressful is it? Does it impact it? And does that person, have to have a different level of understanding of the nature of your job?
Yeah.
So I think it's good for people to know.
I think so. Yeah. So I'm married. I have a dog. we don't plan on having kids.
Yeah.
And I think surgeons are one of the, I guess, more stressful jobs. Because
I think one of the stereotypes with surgeons is that a lot of them get divorced because they're so devoted to their jobs and they're never present at home, right?
So, So you can see I'm at home more than I'm at work.
Well, you're preserving a relationship, man. That's good.
So that, I mean, you gotta have your priorities.
Yeah.
One of the most expensive things you can get is a divorce.
That's true, man. That's very true.
Yeah.
That's smart, man. But it does put stress on the relationship, though, right? Like it's
depends, right? Like so, what your partner expects. I think it's
because working into the night and sometimes like being on call or getting called into like you have to go, right? You can't you got to leave whatever you have in the middle of a date night. You get a call. You got to run to the hospital. You got to leave that
when
person.
You're on call.
Good thing is that doesn't happen too often, right? But it does happen, right? It can happen, and
it depends on your group, I guess, right? So we have 10 general surgeons, and I probably do the most call out of everyone. But for the other 9 surgeons, they're on, I don't know, like 3-4 times a month. Most of them have kids and married, and so it's still possible to have a normal family life as a surgeon.
Yeah. Very interesting. And in terms of kind of the balance that you talked about, working and having, almost 3 weeks off and getting your energy back and your sanity, I guess, your mental.
For sure. Yeah. By the end of like, usually I work week on, week off, week on, maybe 2 weeks off, occasionally 3 weeks off. And by the end of like 2 to 3 weeks, I'm like,
you're pretty toast.
Ready to work.
Oh, like you kind of get bored, you want to go back, right?
Absolutely.
Yeah. But I guess after the week of work, you're pretty.
Yeah, after a week of work, I'm ready to relax for a bit.
So what do you do, man? What do you do when you're off? Like
anything.
Relax,
chill. You can do whatever you want. Yeah, you can travel before COVID. You can travel again now.
I guess you can actually. You have like good amount of time to be able to travel.
Yeah, for sure. Yeah,
like pretty open.
Yeah, so before.
I guess one of the perks, right? Like if you're like one of those times where like you're 2 weeks off, you can easily.
Yeah. We just did a 3-week road trip to California this past
with
fall.
a Subaru.
Yeah. No, we rented a camper van actually. Camper van.
Really?
Mercedes camper van.
Oh no way! Dude, these are nice, man.
Yeah, those are very nice.
I've never done that. I've always wanted to do something like that.
It's amazing. Yeah. Lake Tahoe, Mammoth Lakes,
I've never actually
Yosemite.
been there. It's pretty good.
Yeah, highly recommended.
And the camper van, like there's like it's got everything inside.
Yeah. Bed, washroom.
Oh man,
kitchen.
Do that. Okay. Yeah. That's pretty good, man. You're just obviously keeping fit, exercising, and everything.
Trying. Yeah, I gotta come to you to fix up my little things, toes and elbows,
shoulders, hands, everything. Yeah, you gotta come, man. No, it would be my pleasure. And interesting about kind of like the career choice, I think I kind of want to go back into that a little bit. And when you talked about the work-life balance, because we obviously went to the same high school together, and I think we were both pretty good students. Well, I was pretty good too.
For sure.
And we both went to the Science 1 program at UBC. And for those people that don't know what Science 1 is first year, undergrad science program where I think they select some students, maybe like 40, 50 people only, right? So you have to have pretty good marks. And I think there was like a little bit literal interview process as well, right? I can't remember fully, right? But I think...
Yeah, I don't know how we got into that.
I think you got into it, and then I kind of like... being competitive, I'm like, I gotta get into it too, right? And I think, because I hadn't even heard of it, and then you're like,
it was definitely more competitive to get in.
Yeah,
but the people who get in are, I don't know. I think some get in for various reasons, right? Like, I think it was meant to build scientists. versus,
it was that. So that was my thing. Like I remember we were there, and then the format of the program for my master's, I know we both experienced it, was that where we just sit in the classroom. It's like 40, 50 of us, like pretty good students.
It's like high school again, right?
It's like high school again. And like 9 hours a day, you're just there, and then like all your professors come, they come to you, and then like sometimes we were like sitting, I think 4 of them, like chemistry, physics,
it's very
math.
different. They're very different than the usual UBC undergrad.
It wasn't like class per class. It was like kind of like teaching at the same time. Like the chemistry professor would jump into a math question equation. Like the biomechanics of moving, and that's a math equation for like molecules, like attracting. So it was like very comprehensive. It was a bit too much, I think, in my opinion. But yeah, it was making pretty much scientists. But I think what kind of changed my perspective was that kind of threw me off a little bit, in terms of, my own personal background. I always been like in sports and, being like very social. I remember you were like the only person after class, people were like, hey, let's go grab a beer. But everyone's like, oh, let's go like learn this, right? And I'm like, and nothing wrong with learning. I love learning too. I call myself a happy geek, like an active sporty geek. But I think over the undergrad years, it kind of diverged a little bit where, I, same as you, wanted to become a surgeon as well, but like kind of like childhood thoughts, right? But over, the course of, kind of like not knowing too much of, what my lifestyle would be, I was working at a physiotherapy clinic, and I fell in love. I'm like, oh, this is my calling. This is like my background, with sports and like being hands-on, like right on top of an injury. I think with some of these stereotypes that I heard about, the life of a surgeon, always working, you're never at home, you can't have a family, you can't have a business. And I was like, I'd love to have a clinic one day, right? And so kind of I diverged. And like, now seeing your life, I'm like, like you have a lot of good things going on as well, right? But I love obviously my job, and I'm a business owner. But
it's I don't know. It's hard to know what or which path or what opportunities will come up, right? So I think just being open to various opportunities will be is important, I think.
And I think part of the reason that I'm doing this show and having experts and professionals like yourself coming on is to kind of talk about this stuff, because I didn't have this information. If I had this information about what the life of a surgeon would be, what the life of a chiropractor, what the life of a rheumatologist or radiologist would be, or a physiotherapist, any person like in the whole spectrum of the medical profession, is that when you have a little bit of the answers, you can make better choices, right?
For sure,
obviously you're happy, you're very satisfied with I'm super happy, I love my job, I'm a business owner as well, and that's also a side that a lot of people in the medical world might not necessarily get to experience.
We're very bad business people. Like running a clinic is like our nightmare.
And a lot of people don't even have clinics, right? You don't have a clinic, right? And most likely
I rent an office, and I don't. So just very, very minimal, as little as I can. But like family docs have to learn how to run a clinic, and that's one thing that they don't teach you in medical school.
No, they don't. So I think it's good to have kind of these conversations, for the next generation. Our goal with this is to make sure that the next set of Marvins, that are coming on, the teenagers and the young adults that have these like thoughts and plans, maybe, someone like your path was pretty smooth. You became a surgeon, but maybe someone thinks that they want to become a surgeon, but he or she, after, doing a bit of listening and learning, it's like, hey, what, surgery is not the thing for me.
For sure. It's good to have, like most people don't have access to all these professionals, right? Like it's, I think for you to get all these people on will be quite a good resource for sure. Yeah.
No, that's awesome. You've always been a champion of like, from even, you were like the most chill, relaxed guy that I know. And, you always like get your thing. No, I always learn from you, man. Honestly, like you always sort of relax, and you always look at, hard kind of experiences, or all the grind work that you have to go through. You always look at it in a very positive way. It's like, it's like part of our job. I got to do it. I get it done.
I think so. Yeah, you got to have some work ethic and put into it.
Yeah. You have a very good approach. So I'm always learning, man. Every time I see you, you're always like, hey, everything's good. And I love the fact that you appreciate the important things in life. Like you obviously, not everyone cares about what kind of a life they have. Like, if you have more money and you can live more comfortably, but there's a balance, right?
For me, I think like having free time is priceless, right? Like it's you see people making $1 million a year how much free time do they have? Like, I think the more money you make is definitely as surgeons, the less free time you have, because you're operating, you're doing things, you're not working.
Yeah. No, and that's really good. That's, I think, important to say. Balance of everything, right?
So.
Career, success, money.
Have the right goals and
you gotta
priorities,
right? And live your life. It's important. Well, that's a good way to leave it. But one final question that we have from all our guests that we have is that if you go back in time, would you pursue the same career? Would you do it again? If yes, what advice would you give to the next generation? If not, what would you have done differently?
I think what I have now, I'm very happy with. I think if we and anyone who's played sports growing up is like, if you had a chance to be a professional athlete and whatever, maybe I'll give that up.
Yeah.
Do your professional career, like sports career first, and then do your professional, do like medicine afterwards or something. Yeah.
Something like that, because there's a limit to that. And then what advice would you give to the next generation? Making a career choice like this.
Career choice. I think being open. I think working open to opportunities and doing your research is important. You want to know what you're getting yourself into, because sometimes we kind of follow blindly and just keep your head down and follow whatever path is right in front of you, and not everyone ends up very happy. Yeah.
Make good choices.
I think so. I think
and plan.
Yeah.
Awesome. I think that's a perfect way to end the session. Marvin, thank you very much for coming. Thanks, pleasure, man. Cheers, man.
Yeah, so.
Thanks.